Welcome back to Western New York Living. Now, imagine if you wake up every morning with burning, biting, stabbing, even shooting pain in your arms and legs. Even worse, if you experienced a loss of sensation in your feet, ankles, or toes, which leads to difficulty even getting around. Well, close to 20 million, and some even estimate possibly 50 million Americans and Canadians, this problem is real, and it's called peripheral neuropathy. Today, we're lucky enough to be joined by one of the leading experts in treating this disorder. It's Dr. Carrie Chousky of the Chousky Center located in Toronto, Canada. Dr. Chousky, thank you for joining me.
Thank you for having me.
I know your approach for treating this debilitating condition is with technology and not with pills or drugs. Before we get into this, what exactly is peripheral neuropathy, and why haven't people heard of it?
Well, if you had it, you would have heard of it. Peripheral neuropathy means outside the brain and spinal cord. Neuropathy means nerve damage or disease. So what we're talking about is damage to the small fiber nerves, and through insult or injury, and in the presence of poor circulation, these nerves can become necrotic and die. These small fiber nerves send communication between the body and the brain and back again. This disorder we refer to as what we call a stocking and glove disorder. So when we talk about peripheral neuropathy, we're emphasizing the nerves in the hands and the legs and the feet.
Dr. Chousky, your description sounds quite painful. What is life like for somebody suffering from PN?
Well, it's really on the low side of awful, because you see, pain permeates every level of their existence. There was a study recently done that demonstrated that the people living with peripheral neuropathy pain is much like somebody living with cancer, Parkinson's disease, or diabetes. So their quality of life is extremely low.
So, Dr. Chousky, from what you just told me, how does someone get peripheral neuropathy, or how do they know they have it?
Well, because we're dealing with very, very small microscopic nerves, based on their size, there's a host of conditions that can contribute or cause this problem. So we're talking about conditions like diabetes, the sugar spikes. About 50% of diabetics run into this issue. People that have been subject to chemotherapeutic drugs, they are neurotoxins. Again, it's estimated at some point up to 100% of chemotherapy patients may experience neuropathy. People have things that impact the spine, things like spinal stenosis, arthritis in their spine, bulging and herniated discs. And perhaps many people don't know this, but the #1 prescribed cholesterol medication, a group called statin medications, can contribute or directly cause up to 30% of all peripheral neuropathy.
Doctor, for many conditions today, there's some sort of early detection. Is this the case with PN? Or is it the case that you know it when you have it and there's no way to know you're at risk?
Well, because neuropathy, the symptoms of neuropathy may begin with numbness or tingling or slight changes, most people would not go to the doctor at this point. They may just, wave it off as something they'll just deal with. However, when the condition runs into pain, burning, discomfort, that's typically when they're going to enter the medical community. And quite often they'll go see their family doctor very distressed, and they'll get pain medication. And from there, if it doesn't work, they may get sent off to a neurologist or a pain clinic. But again, the outcome is more pain medication. And for a lot of these people, when the pain medication doesn't work anymore, they're just told to live with it. But what I want to emphasize is at the Chousky Center, what we focus on is a complete evaluation. We're going to be able to not so much be concerned about the cause of the neuropathy, but delineate the extent and character of the nerve damage. And if a patient is diagnosed with peripheral neuropathy, we're then going to lay out a very specific protocol to rehabilitate and to regenerate those small fiber nerves, thereby restoring function and reducing discomfort.
Dr. Chousky, your treatment sounds very interesting. Exactly how does it work, and can it help the hands and arms as well?
Yes, it can help. It does work with the hands and the legs and the feet, because again, we're talking about the nerves that are furthest away from the body. So quite often the pattern is in the hands and the feet. But the treatment that we're actually performing is we're literally bathing these peripheral nerves in a form of infrared and cold laser light diodes, literally bathing all the tissue, all the skin where these nerves are damaged with this type of laser. So what we're doing is bringing in oxygen and nutrients to these damaged nerve fibers. And then after we do that type of protocol with our patient, that's when the real doctoring begins, and the rehabilitation technologies we bring in to now stimulate the skin to regenerate and rehabilitate these nerves. So again, to reduce the pain and discomfort.
Doctor, I guess the most important question for anyone watching right now would want to ask is, how successful has the treatment been?
Well, the Chousky Center is part of the Neuropathy Treatment Centers of America. And the Neuropathy Treatment Centers of America is a non-profit organization whose mission is to rid the world of peripheral neuropathy pain. And we did a nationwide study with our protocols, and there was well over a 90% patient satisfaction with our protocols.
Dr. Chousky, I know we have to head out to a quick break, but I know you're going to stay with us. And when we come back, you're going to be joined by one of your patients. And I know she's got a great story to tell us about how your treatment has changed her life. Lois, Dr. Chousky explained to us what this condition is earlier in the show, but could you tell everyone watching right now what your life was like before treatment at the Chousky Center?
I'm not going to use a word that isn't allowed on TV, so I will say it was horrible. I couldn't move around. I had a permanent limp. I couldn't involve myself in anything that involved putting weight on that foot. So I was virtually handicapped.
I couldn't even imagine living a life like that. How has everything changed following the treatment?
I'm now golfing, curling, dancing, walking. I couldn't walk around the block before Dr. Chousky treated me, and now I walk as much as I can and love it.
Lois, I'm so happy that you're able to enjoy life again. But doctor, I have to ask, how long does the treatment take? And most importantly, when do people start seeing that difference?
Well, actually, that's a fascinating question. What we see in the office is that in as little as 6, perhaps even 5 treatments, patients will start believing and feeling that they think that there's a difference happening. I can tell you that at the 10th session, we do a complete reevaluation, and we compare that to our initial session so we can objectively identify the improvement. And by 2 months, most patients are completed their care program.
Doctor, I know you're aware of this, but the thing that amazes me is that you can physically see a difference in the patients. Now, I saw these pictures before we went on the air, and you can see it's a little hard to look at some of these before pictures. I mean, it really looks painful, but there truly is a physical change and not just a feeling inside a person's body.
Yes, there is, and you're right. When you look at those pictures, those feet really illustrate and demonstrate what a lack of circulation can do to the feet and a poor communication between the nerves and the body. But by applying that infrared and laser energy into those areas of the body, we're not only bringing blood and oxygen in, but we're draining all that fluid out. And that's what, remarkably, we are seeing how quickly those feet can change.
I'm amazed at how much more comfortable the patients look after these treatments. I can only imagine the difference this is making in people's lives. Dr. Chousky, thank you so much for joining us today and for giving our viewers such great information and insight into the treatment of peripheral neuropathy. And Lois, I am so glad you're feeling so much better.
Thank you, Janet.